Namaskar. There have been lots of developments in the field of medical genetics, and genetics, which was mainly considered as a research specialty, has come into the clinical practice and really helping the patients and families with genetic disorders a lot. So, how does these facilities or recent developments reach the patients in India? And for this, Department of Biotechnology has started a very ambitious and very important program named UMMID, and this is really a unique program, and it is based on the unique methods of management and treatment of inherited disorders. So, this is a multi-pronged effort to see that the patients get benefit of recent advancements in the molecular genetics, and as well as the doctors get training in these various this modern specialty. This is an initiative by the Department of Biotechnology, and it aims at training doctors in medical genetics as well as creating facilities for diagnosis and treatment of genetic disorders, not only in big hospitals, but also small hospitals, district hospitals in the backward districts of India. As the name says, UMMID means Asha ki Kiran or rays of hope. So, I will talk about this particular program in some details. This is an outreach program. So, basically the tertiary care hospital services should reach the populations in the aspirational districts where the women and children from lower socioeconomic strata take the treatment. The objective of this particular UMMID program is to usher India in the era of molecular medicine. The plan of UMMID initiative is to link the well established centers in the medical genetics to the upcoming centers, and as I said, also to provide these medical genetics services in district hospitals and make them a part of a routine maternal child care and establish various preventive genetic facilities in these district hospitals. Training and patient care, both are important for really improving the patient care. So, as I said, the medical genetics services should be established, the patient should become aware of these services, and also there should be trained specialist manpower, that means clinicians trained in the medical genetics diagnostic facilities as well as genetic counseling services. So, the objective is to establish centers of genetic diagnosis and patient care, training of medical doctors in genetic diagnostics, and basically empowering the doctors with these modern genetic testing tools, and so that the patients at every strata of the society get the benefit. For patient care, this means improving diagnosis, establishing prevention services, screening, population based screening services like newborn screening, thalassemia screening, and providing genetic counseling services. There are three components to it. One is fellowship in genetic diagnostics, and this is available for doctors in government hospitals. It is 6 months fellowship, so that the doctors get hands on experience in working in the various modern molecular genetics laboratories, and in this process about 100 doctors will be trained over the next 3 years of the period. The various centers in medical genetics which are providing such type of training program are given here, and this includes Sanjay Gandhi Institute of Medical Sciences, Lucknow, AIMS, New Delhi, Maulana Azad Medical College in Delhi, as well as CMC Vellore, Diagnostic Division of DNA Fingerprinting, Institute of Center for DNA Fingerprinting and Diagnostics in Hyderabad, Department of Hematology in Vellore, as well as ICMR Institute of Immunohematology in KEM, Mumbai. So, these various institutes will provide training to the doctors, so that those doctors from government hospitals can go back and establish diagnostic centers in their institute, parent institute. So, these are called Nidan Kendras, and DBT is funding these Nidan Kendras so that they can establish infrastructure for DNA based diagnostics, and at present there are 4 Nidan Kendras established, and probably many more will be established in the process over next 3 to 4 years. So, this type of infrastructure building will help to develop DNA diagnostics all over India. The third component is prevention of genetic disorders, and this has taken a very important role, because these preventive services will be run by the medical genetics centers in tertiary care hospitals, but they will be outreach program to reach the women and children of aspirational districts, and this includes antenatal screening to identify pregnant women at high risk of genetic disorders by asking them questions, then also doing their screening for beta thalassemia, and then those women who are identified to have carriers of beta thalassemia, they will be provided further testing as well as prevention of for thalassemia major. The other component is neonatal screening. So, neonatal screening for treatable metabolic disorders, and these include congenital hypothyroidism, biotinidase deficiency, congenital adrenal hyperplasia, galactosemia, and G6PD deficiency. The second component is newborn screening for visible birth defects, and these naturally will be taken for treatment to appropriate centers, and RBSK programs provides free treatment to various visible birth defects as well as congenital heart defects. So, with these facilities, antenatal screening by various questionnaires, one will be able to identify families with previous children with genetic disorders like Duchenne muscular dystrophy, intellectual disability, etc., and previous children with malformations, especially neural tube defects, mothers taking drugs for epilepsy or having diabetes mellitus. So, such type of high risk women can be provided appropriate preventive strategy as well as genetic counseling. The other part of antenatal screening is beta thalassemia screening, because this is the commonest genetic disorder in India. All pregnant women will be screened for beta thalassemia, and appropriate genetic counseling and further testing is offered. So, with these particular preventive programs running in aspirational districts all over India, they are an important way of public education, because once these patients attending and pregnant women attending these hospital get this information, undergo these tests, also see the various posters which have been prepared for this program, and then this type of awareness will pass on to the population, and everybody knows that such type of screening test of pregnant woman as well as the newborn baby are essential part of the healthy baby birth. So, these birth defect surveillance, as I said, visible birth defect surveillance is an important component of this screening part, and these facilities Department of Biotechnology has made available free of cost for families with attending the aspirational district selected for this particular UMMID program. So, basically it is a way to reach unreachable and providing outreach facilities by the tertiary care hospitals. So, summing up, this is a 3-layered program where the outreach facilities for aspirational districts will be created. Also, the clinicians in those hospitals will get really training into the genetic counseling as well as screening programs. Secondly, the diagnostic centers will be established, which are known as Nidan Kendras, and for these Nidan Kendras establishment, the clinicians will be trained by already existing medical genetics departments, and such type of training which will spread the message of medical genetics and facilities for genetic diagnostics all over India, and this has created a very great ummid in all of us who are working in medical genetics, so that we can see the future that the patients and patients and families with genetic disorders get the best type of diagnostic services and treatment in India. So, this is expected that with these type of facilities, lot of facilities will be created for rare disorders, because 80% of rare disorders are genetic in etiology, as well as the training of clinicians will help, and all clinicians which we want to be empowered with the knowledge of genetics and genetic diagnostics, so that the patients coming to their pediatricians, obstetricians or any clinician get the appropriate diagnosis as well as the proper management of those patients with genetic services. Then it will also create awareness about newborn screening and population based screening, newborn screening, thalassemia, and thousands of women and children in aspirational district hospitals will be benefited in the process. So, UMMID will spread the reach of diagnostic facilities for rare genetic disorders, pharmacogenetics, prenatal diagnosis and population based genetic prevention to masses. So, it is very important that many more clinicians and patients become aware of these facilities and really spread the message, so many more centers can join these training programs, develop Nidan Kendras. So, basically we want all of clinicians at various levels in government hospitals, whether it is medical colleges or district hospitals, to work together for the better future of the next generation. Thank you.